Hello, my name is Jan Samuel. I'm the Director of Service Improvement and Transformation here at Epsom and St Helier hospitals. We pride ourselves on putting the patient first and giving great care to every patient every day. So how do we know we're getting it right? And if we're not, what do we do about it? So to find out more about our patients' experiences whilst they're in our hospitals and what's important to them, we embarked on a drive to gather more feedback from a variety of sources. While some of the feedback was very positive and we were heading in the right direction, there were some areas that we needed to improve. So I'd like to introduce you to some of our teams on our elderly wards who can share with you what we discovered, what we changed as a result, and what we plan for the future.
Hello, my name is Carol and I am the ward manager of A3 hip fracture unit, and we are one of the best in the country. The improvements we've made on A3 for the patient experiences is that in the morning the nurse in charge will go round and introduce themselves to each patient, inform them of the nurse that they're looking after them for the shift, and also write the names on the whiteboard. Key to successes on A3 is that we've got a happy team spirit and we all work together. Doesn't matter who, if you're a doctor, a therapist, a nurse, but everybody's expected to provide good patient care and look after the patients. We know things are improving on A3 due to the positive feedback from the patients on discharge, and they complete a questionnaire. Anything not positive we've acted on. One of the plans we have from the patient experience is to start a lunch club where patients can sit together and socialise over lunch.
Hello, my name is James and I'm a physiotherapist working in care of the elderly medicine. I just want to take this opportunity to talk about how we use the whiteboards in order to update the other healthcare professionals at how a patient's able to stand and walk to and from the toilet whilst they're here on the ward. We're also using magnets on the ward that we're piloting at the moment, and these magnets signify patients who have visual and hearing impairments, patients that need a medical review at night, have a diagnosis of dementia, and also those that are at risk of falls. We're also trialling a patient booklet up here on the care of the elderly wards called A Little Bit About Me. The idea is that the relatives will fill it out and will provide us with a lot more information about the patient. It's for patients who have memory difficulties, and it enables us to tailor our care to the patient and improve their patient experience.
Hello, my name is Inse. I'm the ward manager at C5. We meet and greet all our patients. Getting a feedback whilst the patients are in hospital can make a real difference to their care. Some of my proudest moments was when family approached me and told me how impressed they were about the care and the standard of hygiene that we give to their mum.
Because my mum, Pauline will tell you, was a very, very smart lady, really, wasn't she? She had her hair done every week, her nails were done every week. Every couple of hours they changed her, made her comfortable. So it was very nice that they paid attention to her cleanliness and etc. Because that would have made her happy, whatever. When time was getting very close and they had to call us here to come up on a Saturday morning, wasn't it? Whilst we were coming up, they actually put a nurse in with us to sit with us, so that she wasn't on her own waiting for us to arrive. She had something, somebody there. She got fantastic care here from people that cared. Simple as that, really.
Hello, my name is Patricia Mendonça. I am a ward sister in Ward A5, care of the elderly at St Helier's. Patient experience, especially in the care of the elderly wards in A5, it's effective communication, working as a team. When our patients come in, many of them may have not been in hospital before, and it's just being able to support them and welcoming them and making them feel at ease. Privacy and dignity is very high on the agenda, and our gentlemen had the hospital gowns, and I felt in order to maintain privacy and dignity, pyjamas would be a better option. And I was lucky enough to speak to the management team, and we were able to get the disposable pyjamas.
C5 looked after her very well, and the sister was very informative. If we had any queries or what care mum would need, she helped us.
From a doctor's point of view, patient experience is what it's all about, because we're here to treat patients, not conditions, people with conditions. People who are frightened, people who are anxious, worried about themselves or their loved ones. And our job is to find out what's wrong and see what we can do to help them. When we are doing our ward rounds, our junior doctors are looking at how we interact with the patients. They're also listening at what we say and trying to learn from us, but I think they're also learning from our behaviour. We want to invest in our elderly care services. We're expanding the numbers of consultants. We are developing different models of ways of managing older people.
This has been a window into part of a wider programme that we've designed in putting our patients first. You can see from our teams that they're passionate about improving our patients' experience and in delivering great care. Feedback's really important to the way we do things here at Epsom and St Helier. We respond to it and we try to involve our patients and their carers in shaping how we can make a difference. We're well on our journey to continuous improvement and we're really proud of what we've achieved so far.